Welcome to the VC Coffee Talk. I am so excited today to have a very special guest with us, and that is Speaker of the House, Philip Gunn. I have to tell you that probably a month or so ago, a little bit on a whim, I texted him to ask him if he would join me today for a coffee talk because I just expected that he wouldn't be able to, that he'd be too busy. The session had ended, so I tried to time it just right. But it was my lucky day because he agreed to do it and was willing to do it, and I'm really thrilled that you were willing to do it and that you had time to do it. I know this is a busy, busy time for you. We were just talking before the cameras went live. The session really never ends for him. There's a lot of people wanting his attention, and I am very honored that he agreed to come be part of this today. I think it is a demonstration of the support that we get at the medical center from you and your colleagues. And I guess one of the things I want to say as I kick this off is how much we appreciate that support. I have reached out to him many times personally, and he has always been responsive and willing to talk to me about whatever the issues are. And I know that many others from the medical center talk about the things that are going on here. He's informed of our issues and has been a strong supporter of the medical center down at the Capitol. And so I want to be sure I start off by saying thank you for that. We do appreciate that. I see us as the state's medical center, and I hope that you do as well, and it is a good partnership that we have. That's not to say we get everything we want now. I bet I would. I bet I could wager that of all the people that come to see you, nobody walks away and says, I got everything I want. So, but we are always heard, and really appreciate the support that we get from the state of Mississippi and from the legislature and from your leadership. So I want to start with that.
Well, thank you. You're very kind, and I appreciate that very much. You're right. We do the best we can. We try to give everybody as much as we can. We like to spread our dollars as far as we can get and get the most return. From I look at it as an investment. Anytime we spend taxpayer dollars, we're investing in our state and hoping to get a nice return on that. We try to be good stewards of the taxpayer dollars, and the University Med Center has always been a tremendous partner with us, but also for the state of Mississippi. Y'all do a great job in health care, both in the hospital and the teaching facilities, and it's been a great partnership. Y'all do a great job. I think this is my first time in this building. I was here the day we did the groundbreaking.
Yes, I was going to say you've been on the ground.
Well,
but yeah,
I guess so. I was the speaker when we passed the bond bill to build this new facility, and was here during the groundbreaking, and I think I was here during the ribbon cutting too. But I don't know that I actually had time to come into the building that day. So I think this is my first day into the new building, and it's magnificent.
I hope you feel proud
as I walked in today, I thought it's a great facility. Very proud. I'm very proud of it as a legislator, but I think all Mississippians should be proud of it as well.
Thank you for that. So what I'm hoping we can do today is touch on a variety of topics, but first of all, a little bit about you and kind of get to know you a little bit. You grew up in Clinton, and I think people around here know that. They may not know that you attended college out of state. Tell us about that a little bit.
Okay. Yeah, I'm a native Mississippian, born in Hattiesburg. My father and mother were from a little town called Lena, Mississippi, near Carthage.
I've heard of it.
Yeah, and it's not far from here, about 50 miles away. But after my father was in school at Southern, and he graduated and moved back to his hometown. So I lived the first 4 or 5 years of my life there in Tuscola, Mississippi, which I'm proud of. And then we moved here. My mother and father both got jobs in the Jackson area, and so we moved here, and I ended up graduating from Clinton High School. Had not ever heard of Baylor University, didn't really know much about it, but there were two men in Clinton, my hometown, that had graduated from there, and they both decided I needed to go to school there. And at the time I was looking to play football, so Baylor offered, they had recruited me. They never really offered me a scholarship, but I chose to walk on there and played 3 years, or tried to play. Let me qualify. There's a difference between playing and being on the team.
But you were on the team.
I was on the team.
There you go. There you go.
And so went there, and I like to tell I think this story encapsulates my athletic career at Baylor. When I first became speaker in 2012, one of the guys that I played with was on the Board of Trustees, and he nominated me for an alumni award, Public Servant of the Year. Since I was the first Republican speaker in 136 years, he thought that was notable. So he nominates me, and lo and behold, I get the award. So the ceremony was at halftime of the homecoming football game, and they gave out a number of other awards as well, but they took us down on the field at halftime and presented us our awards, and they called our names out. I told people after that awards ceremony that I spent more time on the playing surface during that awards ceremony than the whole time I was on the football team. So that kind of tells you what my athletic career was like.
But you were on the team.
I was on the team.
You know, that you had to put in a lot of hard work for
as
that.
a side note, I'm very proud of our basketball team. They won a national championship about a month ago, and I have a Baylor shirt. I started to wear it today, but I thought I'd dress up a little more than that. I've been wearing it every day, though. It's in the wash right now. But I went to Baylor, met my wife there, and then came back to law school at Ole Miss and finished there and moved back to Clinton. Been there since 1989 and been practicing law here in the Jackson area for 30, how many years that is? 32 years, I guess.
So I want to ask you about, from the law school to law practice to then running for office, because you were in the House for some years before you were the speaker. Kind of when along that spectrum of time did you decide, I think I want to get interested in politics? But before I ask that, as I was looking yesterday, I was doing a Google search and just looking at some information on you, and something caught my eye that while you were, I think this was out of one of the Baylor publications, but while you were out there in Texas, that you waited tables at El Chico.
I did.
So when I was in med school, I waited tables at Chrishell's.
All right.
So that caught my eye. And I have told my kids before, my kids are all college age or a little bit older, that while I was waiting tables, one of the important life lessons I learned, I'm going to ask you if you learned an important life lesson waiting tables. One of the important life lessons I learned was that there are some people that you just can't please. The food could be perfect. The temperature of the room is perfect. They get their order quickly, but yet they're not happy.
Yeah.
And then there are those people that you could drop something on them, drop their food on their lap, and they would say, that's okay, don't worry about it, it's all right. Some people you can't please, and some people you can't make mad.
Right.
And the punchline is, that's them. It's really not you, it's them.
Right.
And that was an important lesson I learned while I was waiting tables at Chrishell's. So tell us a little bit about the El Chico time and if there were things that you took away from there.
Well, sure, absolutely. I actually graduated from Baylor in December of 85 and was waiting to start law school in August of 86. So I had about an 8-month window in there where I had to do something, and I got a job waiting tables, which I think is a fantastic way to make good money. And for 8 months, I waited tables. The El Chico in Waco at that time was the number one El Chico in the country. Out of the 120, it was the number one producer, and it was really good. I will tell you, it was not prepackaged. It was made fresh every day, and the cooks were really good, and so that's why it was the number one in the country. So I like you. I learned I think everybody ought to have to be in the food service industry at some point. I think every young person ought to have to work at a Chick-fil-A or work in a restaurant or wait tables, because you have to interact with the public, and you learn how to deal with those people that you just described. And those skills that you develop doing that will carry forward in whatever career you choose to go in. I think everybody ought to at some point have to do that, because it was a valuable learning experience for me. And like you, I have dropped food in the lap of people. El Chico was famous for their margaritas, frozen margaritas. and I dropped one in the lap of a lady one day. I went to put it down and leaned over, and the one on the tray just toppled over, frozen margarita in her lap, and I was so embarrassed, and I apologized profusely, and she was like you said, don't worry about it, don't worry about it. And she went to the bathroom and dried up as best she could, and we rocked on. But you learn those valuable life skills like you're talking about to deal with people, because you have to learn how to negotiate those difficult folks. It's a good experience.
A good experience. So when along your timeline of your life did you say, I think I'd like to get into politics?
Well,
when did that happen?
I never really had a moment where I said I'm going to get into politics. All my life, people have pushed me in that direction and said I needed to do that, but I never set out with that as a goal. The way it came about for me was in 2002, I guess, they redrew the district lines. And people, we just came off the census. We had the census last year. Those numbers have come back. Every 10 years, we in the legislature have to, what we call, reapportion our districts. The law is very clear that every citizen's vote should carry equal weight. So every representative should represent the same number of people. If you are in the legislature and you represent 20,000 people and I represent 100,000 people, that's not equal balance. My 100,000 people don't have the same voice as yours do. Right. So every 10 years we have to accommodate for shifts in population. Some areas grow, some areas decline, people die, people move, and those districts get out of whack. In the House, our districts are around 25,000 in size. In the Senate, they're around 50,000 in size. And so every 10 years, we have to redraw those districts and bring them back into balance. Good example is DeSoto County, Mississippi. Right now, it's one of the fastest growing areas in the nation. And over the last 10 years, those districts have just doubled in size. So we have to go in and we have to create brand new districts. Well, that's what happened in Clinton in 2000, in the year 2000. They redrew the lines, and the town of Clinton got carved up 5 different ways. And we lost our representative in the legislature. And so the mayor and some aldermen and some of the city leaders were very concerned about that. At that time, Clinton was the 10th largest city in the state. And they said, we need to have a voice in the legislature. It's not right that we don't have a voice, don't have a Clintonian representing us. And they had basically carved the town up like a pie and just splintered it off into different other regions of the state. So they came to me and said, we've looked at the numbers and you just happen to live in the part of town where we think a Republican can get elected. Would you consider running? And I said, well, I hadn't thought about it before. How long do I have to decide? They said, you have 1 week. Qualifying deadline is a week from today. So I had to act quickly and made the decision to engage and run, and did. I don't know how many people remember my race. They probably don't, but I ended up in an election contest. It went all the way to the Supreme Court. It took 3 months to resolve.
Wow.
And the Supreme Court ruled in my favor. There were some irregularities that occurred, not intentionally. It was just mistakes that were made that affected the outcome of the race. And I felt like we needed to pursue those. And of course, I won in court and won at the Supreme Court and got elected. So I started serving in 2004. And from 2004 to 2012, I was a regular House member. And then in 2012, my colleagues were kind enough to elect me as the Speaker. A lot of people may not understand the difference between the Speaker and the Lieutenant Governor. There's very little difference. We both preside over our respective chambers. We both appoint the committee chairman. We appoint the people to the committees. We assign the bills. We are paid the exact same amount. But the only difference is the Lieutenant Governor is elected by popular vote of the people of the state. The Speaker is elected by the members of the House. And so I got elected in 2012 by my colleagues, which is a high honor, and I have tried to serve them well ever since. And now I'm entering
almost 10 years.
The 11th year. I just finished my 10th year as Speaker, right?
Well, those individuals that came to you back at the beginning and encouraged you to run probably could not didn't have the ability to and the foresight to really realize the impact it would have on the state. But that was a good day for Mississippi.
Well, thank you. You're kind to say that.
I think we owe them a debt of gratitude, whoever they were that approached you, and asked you to consider that. So you've been the speaker now 10 years, and these last 2, wow. Just give us a sense. I know from my own job I have here and what it's like to do this in a normal year and then during the pandemic. Give us a sense of kind of what it's like to be the speaker in a pandemic.
Well, as I've said, there's no playbook. We went down a road we've never been down before. Last year was historic, and I hope we never repeat that again. The freshmen who started last year, I feel for, because they just have no idea what a normal year is like. We started out in January. I don't know how many people know this, but our session runs 90 days. We usually start the first Tuesday in January and run for 90 days, which puts us ending around the 1st of April. Now, the only exception to that is the first year of a new term. And last year was the first year of a new term. We have a 4-year term, and under our Constitution, that first year is a 120-day term. So we were scheduled to go from January, the first Tuesday in January, whatever that was last year, to about the 1st of May. As you recall, and everybody recalls, middle of March, the pandemic hit in full force here in Mississippi. And at that time, Dr. Dobbs, and we talked to other leaders, and I talked to you. You called me, in fact. I remember that. And gave your opinion about how this is serious and we need to take some serious measures. And the decision was made to suspend the session. Now, fortunately, it was at a good point. We run by deadlines. A lot of states don't. Their legislatures just meet till they get through. That would wear me out. I'm glad we don't do that. But we have deadlines. We have a deadline to introduce bills, a deadline to pass bills out of committee, a deadline to pass them off the floor. And that helps us get the work done and leave by a certain time. But because of that, we had to suspend our session. Anytime we change the rules, it takes a 2/3 vote in both chambers. So we decided in consultation with the Senate that it was a wise thing for us to take a break. Let's see where this thing goes. And at that time, nobody really knew. Not even the medical professionals knew where this thing was headed. So we felt,
as you said, we didn't have a playbook.
No playbook. Playbook for this. And so in talking to you and talking to Dr. Dobbs, we decided it was probably wise for us to suspend it for a month or so. And we passed a law, a resolution, I should say, that gave the lieutenant governor and me the flexibility to call the legislature back when we felt it was safe to do so. Keep in mind, we operate on a fiscal year from July 1 to June 30. So we felt like we had to get the work done before July 1, had to get the budget done at least before July 1. But we gave ourselves a break until May 15, I think. We probably took about a 2-month break. Came back about May 15 and was able to get the work done. But we also left the door open for us to come back later in the year. As you recall, the federal government was sending us the CARES Act money. They put a December 30th deadline on us to spend that money, and we felt like we needed to wait as long as we could to have more information, to make better decisions. We could make a decision in May on how to spend that money, and October may realize there's a need out there that we didn't anticipate. So, as you know, we extended the session all the way into October last year, which was historic. Never has happened in my knowledge before. Hope it never happens again. I tell people it is mentally and physically exhausting, though, to have all that going on. Usually, in the normal course of events like this year, we're done by April the 1st, and you got 9 months before you have to come back in January. And you take that time to re-energize and decompress and get mentally right again so you can come back in January. We didn't have that this year. We went all the way to October, and October is when we normally start getting ready for the next session. So we just rolled right out of one session into another. I think it caused all of us to be mentally and physically exhausted. But I think we handled it well. I want to commend the Lieutenant Governor and the Senate and commend my House members for the way they handled the pandemic. We did the work of the people. We did it in a safe manner. On your advice and Dr. Dobbs' advice, when we did reconvene in May, we separated the members in different rooms. We social distanced. We didn't require, but we strongly requested masks.
Right.
There's an intercom system throughout the Capitol which allows people to sit in different rooms and hear what's going on. And we were able to do the work in a safe manner. Now, ironically, we had an outbreak, as you may recall, in the House, not so much in the Senate last year, but we had, I think, 35 or 40 people who had it.
Right.
Got it. We left on July 1. We took a break on July 1. And on that day, everybody who came into that Capitol was tested, or temperature was taken, and everybody was good. 2 days later,
then we had an outbreak.
35 people got it.
Yeah.
And I was one of them. And fortunately, my case was very light. I had a cough and I lost my sense of taste, and that was it. But some of my members got hammered. They had fever, they had aches, they had 3 of them ended up in the hospital. So we had some serious cases. But we weathered the storm, we came back and got the work done. I'm proud of the way the legislature handled it. I don't know that we did it perfectly, but we did it diligently, and we were responsible to get the work done. And this year seemed like a breeze compared to last year. So.
But you know, this year, and part of what you mentioned with the members having different experiences, having COVID, including yourself, is what we have seen across the board, which is one of the really confounding issues with this virus. You know, one person may get it and barely have any symptoms, and the next person who is equally as healthy or not,
right,
you know, might not survive it. That's been one of the real challenges for everybody.
Well, you know
that
better than I do.
Yeah.
I'm just a layperson, but I can tell you from my own observation, there is no consistency. It doesn't seem to be consistency.
That's right.
And I only compare that to, you know, flu or other things where your symptoms seem to be the same.
Yeah.
In my just casual conversations with people, it's very interesting to say, what were your symptoms? And some people say, I didn't have anything, and others had the whole gamut.
Yeah.
And yet some of us just had 2 or 3 things, and some of them had a whole bunch of things. There's not really a consistent, doesn't seem to me to be a consistent string of
right.
It's
highly variable, which adds to the challenging nature. In a typical year in the spring when the legislature's in session, myself and my team are down there, different ones. Probably not every day, but it may well be that somebody from the medical center's down there every day for whatever. And this year I went down there for a few particular committee meetings or for a few particular things. Right. But because of the pandemic and the restriction on visitors to the Capitol, it's a beautiful building, and in a normal year when I'm down there, it's bustling. There are a lot of folks down there. There may be, you know, if it's occupational therapy day, there may be a lot of booths set up, and people are sharing information. I've seen tourists down there. It's usually a bustling, busy place. And this year, the few times that I went down there, it was quiet, and it just had such a different feel to it.
Yeah, it did.
And maybe that actually was productive as far from the standpoint of y'all getting things done without it being, you know, quite the bustling place. But it sure did have a different feel to it. I kind of like it when it's busy and bustling, and there's that energy, and you know, you see people looking up at the ceiling, and you can tell they're tourists. They're taking pictures. Right. It really is a beautiful building.
Well, it is, and I will tell you, we have people come from all over the nation who are touring capitals, many retired couples, and they always are complimentary of our building, and they tell us yours is one of the most beautiful in the country. And I have had the privilege of traveling to a lot of different states and seeing a lot of their capitals, and I will have to say ours is one of the most beautiful capitals that I have seen. It's got a lot of history there. You know, it sits on the property that was previously occupied by the state prison. And
I did not know that.
That is correct. The 1840 state prison was built and sat on that property. And so everybody likes to joke that the clientele hadn't changed any. But in 1900 or so, the state of Mississippi sued the Illinois Central Railroad over the failure to pay ad valorem tax and won. I think the case went all the way to the United States Supreme Court. and recovered $1 million.
Wow.
And they took that $1 million and they built our Capitol. Now, you couldn't build the entrance for $1 million today. But in 13 months, they built that Capitol. And the Illinois Central people came for the grand opening. So apparently it was a cordial lawsuit. They came and they were invited and they showed up. But I invite anyone who can to come and see their state capitol. It's a very beautiful building. But a lot of what you described this last session was by design. The Lieutenant Governor and I talked about we need to get the work done. We need to push forward. We want to get Mississippi back to work as quickly as possible. We want to get back to normal as quickly as possible. And if we, the legislature, expect the school teachers and other people to go back to work, we too need to go back to work. So we pushed forward. But at the same time, we wanted to do so in a safe manner. And so we limited admission to those who have business at the Capitol. And that's a broad spectrum of folks. Anybody a citizen who wants to come down there and advocate for a bill was welcome. The media was welcome. Lobbyists were welcome. You were welcome because you have a state agency that you're interested in. But we discouraged the tourists. We discouraged the school tours, the regular, you mentioned the MEC days and the insurance days and the realtor days. We discouraged all of that. A lot of those people went off-site to a hotel and invited us to come there. But we tried to limit people in the Capitol to just those who have business at the Capitol and reduce the sightseers and those who are just there on a field trip, for example. And we will get back to that next year, hopefully. Yeah. But I will say, we didn't hardly have any cases of COVID this year, thankfully. I thank the Lord for that, first of all. But I think the precautions that we implemented helped. In the House of Representatives, everybody's either had the COVID or they had the vaccine, and that helped tremendously. I think we had one case early on and in the House, and that individual was young and got over it. And so we had a very productive session.
I sure hope next year the session and lots of other things are more back to normal, and it feels like it's like it ought to be.
I feel like we are as a state. I see businesses are getting
That's
back.
Right.
I don't know how, from a medical standpoint, y'all feel the vaccinations are going, but it appears that we have more vaccinations now, vaccines available than people who are getting them.
We do.
And I think everybody who's wants one has gotten one.
Or they have access to it. They do. So we're very pleased and relieved to see the numbers decreasing statewide of new cases and deaths, and certainly that reflects what we're seeing here. We haven't gotten down to no cases yet. We're still today, I think the number was 29 or so in the hospital, and it's been in the 20s and maybe low 30s for about a month or so, or maybe 6 weeks. So, but certainly a decline from what we were seeing back in January. So that is, wonderful news. We're so glad to see that. There is, I believe, as best I can tell, available vaccine almost anywhere in the state with lots of options. There are drive-through clinics. There are, you can go to CVS, Walgreens, Kroger. There are a lot of places like that, doctors' offices. So I do think that if people in Mississippi are seeking, the vaccine, that they should have access to it. I know there are a number of entities trying to get out to people that may have a hard time traveling and whatnot, and that's good. I feel like that is the path to the future, getting as many people vaccinated as we can. So through this format, there'll be around 14,000, 13,000 folks invited to watch this interaction that we're having. Is there something in particular that you would want them to know or want to say to them about either about the session or just about your thoughts about the next session? I just want to give you that opportunity. We've got lots of faculty, staff, students, like I said, 14,000 people that may take a look at this. And is there some message that you would want to share with those folks?
Well, from a healthcare standpoint, I want to say thank you. Tremendous. This pandemic, I think, has exposed, revealed maybe, just how important our health professionals are. And they have stepped up to the plate. The nurses who are on the floor dealing with the normal caseload in addition to the COVID situation, especially early on.
Yeah.
I was paying attention to the fact that we had shortage of ventilators, we had shortage of ICU beds, or I don't know if we had a shortage, but we were threatened with the shortage.
Right.
And these people were stepping up to provide health care, not only to the car wrecks and the heart attacks and all the other stuff that goes on, but now you got the COVID people coming to the door. I just don't know if there's any way to say thank you enough for them.
Yeah. So
healthcare in Mississippi is a vital issue for us. We all know that. We're a poor state, or an unhealthy state on the whole, and the fact that our health professionals step up and provide those services is tremendous. We also know that healthcare is a great economic generator in the state of Mississippi. For every doctor out there, it generates about $2 million in economic impact. That's huge. So I want to encourage my guests to keep doing what you're doing. Let's don't grow weary of doing good. We as a state try to do what we can to give the support, like you said in the very beginning. We try to give the support that we can. We have a lot of different interests that we have to balance between roads and bridges and education
Teachers
and corrections and all the other stuff that government has to do. But we do recognize the importance of making sure we provide health care to our citizens. So thank you, first of all. As far as the session next year, one of the things that I'm going to be pushing hard, probably my number one issue, is the elimination of the state income tax. I think that is a good thing for Mississippians. When you put more disposable income in the pockets of our citizens, our economy blossoms, and it helps people to provide for their families more. They can provide for their communities in a better way. I'm traveling the state now, having anybody who will come and listen. I'm having meetings all around the state to talk about the details of my plan, and hoping that people will buy into that. So if I come to their town, I would invite them to come and hear the talk and ask questions. I was down in Perry County and Greene County yesterday. I was in Lincoln County last week, headed up to Oxford this week. You know, I've got a full schedule between now and January. I'm going to be traveling the state, talking about the virtues of eliminating the income tax. And I'll invite them to come and hear that. Obviously, if there's anything they ever need, my office is available. My number is 601-359-3300. So they can call, and we'll do what we can to help them.
Well, thank you for sharing that. I appreciate that. A couple of the things that I've been really, I do feel like the pandemic was an opportunity for certainly healthcare to step up, as you said, and the medical center. I hope that people saw some aspects of the medical center that maybe they don't always see quite so obvious. Clearly the healthcare teams were the heroes, you know, that just never blinked. You know, they just did what was asked of them, and like I said, never blinked. But our research teams really stepped up and quickly developed tests and were able to get clinical trials started, and all of that was so important. A lot of that kind of work is going on all the time, but not quite at the same pace or the sense of urgency, and not quite at the same level of publicity and you know, public awareness. So I think I've heard from a lot of people who have mentioned about they didn't know that we did clinical trials here, and you know, we do them all the time, but it just this year has become more I think highlighted, and that's been a good thing for a lot of those pieces of the medical center that aren't always in the public spotlight or in the public eye.
I agree with that. That's the reason I said exposed or revealed what y'all do, because I think the pandemic has shown that. And I want to thank you personally and acknowledge Dr. Dobbs as well. Both of you have been on speed dial for me, because I get calls, you know, from my House members, obviously, who are trying to help constituents. I get calls from my own constituents with medical questions, especially early on during the pandemic when people were trying to find testing sites. They were trying to find vaccines earlier this year. Every time I called you, called Dr. Dobbs, y'all are quick to answer and get the answers back to us that we as legislative leaders need, and then I can pass that information along to constituents. So y'all have been very responsive, and I want to say thank you.
Well,
for that. And your
thank
team,
you.
because I know what you do. When I called you, you pick up the phone and call somebody else.
That's
don't
right.
you?
That's right. That's right. I've got good folks around me and a
You do.
strong team, and
You do.
that makes all the difference in the world.
You do. And
One thing, I've shared this with a few groups, but just to be sure that you know, this is another one of those pieces that I feel like is a bright spot. This is May, so probably in the April, March, varies a little bit by school. But on the education side, recently, in the last few months, we have completed the application cycle for the next year, whether it's nursing, dental, medicine, physical therapy, all the different programs. And back in the fall, back in the late summer, when there was so much in the media and in the public eye of the stress for the healthcare professionals, and that stress is still there, but it was such a spotlight on it, and the pictures that you would see of people with just sores on their face from their mask. At some points, I worried about the impact that might have on applications to the professional schools. I worried that smart, young, motivated, young people who have options with what they do with their life might look at that and say, maybe not.
I don't want any part of that.
Yeah, maybe I'll do something else. Right. But I was just, pleased is not the right word, because it's almost just like motivated, inspired, just awestruck, I guess, by the fact that this year, for all of our schools, we had a record number of applications.
Hey, that's fantastic.
So these talented, young, motivated people who could do whatever they want to with their lives, they didn't look at that and say, maybe not. They looked at it and said, I think
that's where I want to serve.
I think I can do it.
And I think that speaks well of Mississippi.
Doesn't it?
I think it speaks
Doesn't
well of the
it?
character of our
It
people,
does.
and the fact that we're known as a hospitality state. We're known as a state that serves. Anytime we have a natural disaster, you see the way
That's right.
Mississippians respond,
pull
and
together.
this would be right in the same vein as a natural disaster. It's a pandemic, and our people are stepping up to serve, and
I think pulling
that's
together,
encouraging. It's
yes,
inspirational.
It is. It is. So I think we're probably out of time. I may have kept you even a little longer than I said I would. But again, thank you for your support of the Medical Center and for all you're doing for the state of Mississippi. I appreciate your service and your leadership, your accessibility, your rational thought process. and I just appreciate the presence and the leadership that you bring to the House and to leadership in the state of Mississippi. We are better for it. And I'm very grateful.
Thank you. You're
Thank
very
you,
kind.
Speaker.
I appreciate that and enjoyed being with you. Thank you for letting me
you.
be a part of this.
Thank you. Thank you for joining us today. And I hope that everybody has an opportunity between now and the next legislative session to learn a little bit about the income tax initiative and what Speaker Gunn has talked about. I appreciate him sharing time with us today. Thank you very much.